Hi everybody, this is Dr. Ihab Abdurrahman Habtarawa, consultant for Kid Care Medicine at Soba University Hospital, professor of medicine, University of Khartoum. We are still doing our session in basic emergency care. This is trauma module, and in this session we are discussing special consideration, which include burn, blast injury, crush injury, pregnant ladies, and arrangement for handover and transfer. With crush injury, patient can develop compartment syndrome. Compartment syndrome is a build-up of pressure within the muscle compartment that can limit blood supply to the muscle and nerve and cause kidney damage because of myoglobinuria. These patients, they usually have soft tissue injury. You can see bruises. It can be accompanied by fracture, and the pressure and the area is tense, and the pressure is high, and also it can be associated with myoglobinuria that present as dark brown urine. Monitor this patient, monitor urine output and color, give fluid to maintain adequate urine output, splint fracture to reduce further damage, and get surgical consultation or transfer patient to appropriate facility. Blast injury can induce injury in different ways. Visible injury from sharp nails or burn from heat or chemical release. Internal injury from change in pressure. This usually affects the hollow organ like stomach, bowel, lung, and ear. And also the blast injury, it can result in ejection of the body and lead also to some injuries by the fall and ejection. Those subjected to blast injury, as we mentioned, they can be injury to gas-filled organ, lung, stomach, and bowel. And this patient can, if the lung is injured, can present with delayed cough with and without blood, tachypnea, hypoxia, and chest pain. For abdominal injuries, they can have abdominal pain, nausea, vomiting with and without blood, tympanic membrane rupture, and hearing loss, ringing in the ear, pain in the ear, and bleeding. Also, with blast, patient can have burn, and also they can get exposed to toxin, and other injuries can happen. If there is pneumothorax, treat accordingly. You do needle decompression and place a chest tube, give oxygen, give adequate amount of fluid, update their tetanus vaccine. If there is burn, dress the burn. If patient has abdominal pain, consider bowel perforation, and you get surgical consultation and give adequate IV fluid. Burn injury, you can see skin color ranging from pink, red, pale, or black, depend on the depth of the burn. Sign of inhalation injury, you can see soot, ash, or sign of burn nasal hair. There can be swelling of the face and lips and tongue and voice change. These patients should be monitored closely because they can have airway obstruction. Good fluid should be given according to the burn formula. Update tetanus vaccine. There will be severe pain. You have to relieve their pain. Remove any jewelries. Clean and dress the wound carefully because they are at high risk for infection. High risk burn is recognized by burn more than 15% of the body. If it affects the face, hands, groin, joints, and circumferential burn. When there is inhalation injury, burn with other trauma, burn in young and elderly, and significant pre-burn illness. For those at high risk, you need to get plastic surgery involved, and you need to decide if you can handle them or you have to transfer them to another. This is showing how to calculate the percentage of burn. Head is 9%, right arm and left arm each is 9%. The trunk, anterior of the trunk 18%, posterior of the trunk 18%, and the lower limb, each one is 18%. You can divide that into 50% if you are considering the front or the back of the body area. All ladies between age of 10 and 50 should be assessed for possibility of pregnancy by history and pregnancy test. Pregnancy causes many changes in maternal physiology. Even minor trauma may result in harm to the mother or the fetus. Women in their third trimester are at risk for placenta abruption, uterine rupture, and premature labor. Keeping the mother alive is the best way to keep the baby alive. What is work well for the mom, it work for the baby. When taking sample history, ask about gestational age and any pregnancy complications. During primary survey, pregnancy make airway obstruction more likely. So you do the same assessment for the airway, but keep in mind airway obstruction can occur, and there is a high frequency of airway obstruction, and airway management, it could be more difficult in pregnant ladies. Breathing, the diaphragm is pushed up by the uterus, so it reduces the vital capacity. So these ladies are more subjected to shortness of breath and hypoxia. Check for vaginal bleeding regarding circulation. Place patient in the left lateral position, and if they develop seizure, consider eclampsia, and keep the patient warm. Keep in mind that trauma can induce preterm or early labor with and without premature rupture of membrane. Placental abruption or uterine rupture causing blood loss and shock. Seizure and convulsion can happen, and you need to consider eclampsia in that context. During assessment, remember that if the uterus can be felt at the level of umbilicus, this generally indicates that the patient is at least 20 weeks of pregnancy. If greater than 20 weeks, place the patient on the left side to prevent compression of the inferior vena cava. And if there is head or neck injury, consider neck immobilization while you are placing this patient on the left side. And prepare for neonatal resuscitation when trauma occur in late pregnancy, and you need to assess if you are able to manage this patient in your facility or you have to transfer. Trauma, patient can have complex injury and get worse and die very quickly. There are some serious injury, and always you need to assess if you have the competency to handle them, and if you have support in your facility to handle this issue. Serious issues to consider: airway obstruction requiring intervention, patient displaying shock. Those with pneumothorax, after you do the needle decompression, you need to see if there is someone to help you with the chest tube, and what to do if the chest tube is draining excessive blood. Those with pericardial tamponade, after you give IV fluid, they need to get definitive treatment by pericardiocentesis. And those with altered mental state and head trauma, they need special neurosurgical consultation. Pregnant ladies, they need special specialist care. Patient is a child with ABCD problem or head, chest, or abdominal trauma, need special care by specialist. If there is any burn injury, you have to give fluid and get support by appropriate medical service. Remember that if patient require oxygen, this should be arranged during the transfer. If an injured person displays sign of shock, ensure treatment with IV fluid, and this should be continued during transfer. Ensure bleeding is controlled and stopped, and communicate injuries, important medical problem, and what has been done to receiving provider and facilities.